So we're going to roll the chest and the shoulder area with the softball. You can also do this with a lacrosse ball or a baseball, but the idea is Janella's going to lean into the ball, and she's basically kind of, think about digging in. She's looking for the pain spot in the front delt, it's the front of the shoulder, and even into the upper pec, right underneath the clavicle. And you may have to shift around a little bit depending on your chest size and your body structure. But the idea is to find those spots that are a little extra sensitive, a little extra tight. When you get to one, you can roll across it, or you can stop and actually just work on breathing. A nice big 3-second inhale maybe, and then a 6-second exhale. And just kind of breathe through it, try to get that muscle to release, and then move on to the next spot. Chest, shoulder, obviously work both sides. Okay, so we're going to go ahead and foam roll the lat. So what Janella's going to do is she's going to take that roller, she's basically going to put it into her armpit. So she'll go onto her side, and you're going to kind of wedge it up into the armpit. And this is kind of an awkward one for folks. What you really need to do is lift your body using your feet to get enough pressure into that ball. You can also kind of go forward and backwards. But the idea is you're going to essentially roll from the rib cage all the way up through the armpit, that's the lat, and even into the tricep you can actually roll into and just get nice and deep. And as you get better at this, you can do it in one smooth motion, but you really got to be patient with this one. It's also one that for some people, they lay on it and they immediately feel it in that lat, right up in that armpit area, boom, they feel it. Others, they're kind of laying there and nothing's happening. And that's where you got to kind of shimmy back and forth, forward and back, and then even use your feet to kind of lift yourself up and roll up that ball, up that side, down into the armpit and find that spot. And just like anything else when you're doing foam rolling, find the sensitive spots, roll it back and forth, or hold it and breathe through. Foam rolling the spine, working up and down the back. This is generally folks' favorites. They get some good crack-a-lacking going on here. But essentially what you're going to do is you're just going to roll literally up and down the full length of your spine, enjoying it. Put some weight into it. You do have to make sure that if you're wearing a hood or you got a ponytail, make sure you don't get sucked under. But you're going to roll all the way down to the lower back, and then all the way back up the spine, just below the neck. Again, watch your ponytail if you have one or if you're wearing a hood. And you can, even with this one, you can roll all the way up from the top of the spine all the way down to the bottom and even up into the glutes. So just shift your weight, find the spots. You may get some good cracks, they feel good. If you find an area, again, that's tender, sit on that spot, roll back and forth. Make sure with this one, though, you're also really paying attention to breathing. This is one that people tend to hold their breath on. You want to stop. You can stretch over the roller, leaning far back. Take some nice big breaths. And of course, you can do that the whole length of the spine as well. Really, just find some good spots and enjoy this one. Foam rolling the inner thigh. This is one where you kind of lay face down, you kind of get your leg out, think like almost like a dog in a fire hydrant, right? And you want to put that roller right up into your crotch, and you are literally going to roll the length of the inside of your thigh as high as up as you can get, all the way down into that inner knee. And you can actually spend some time in that inner knee area as well, right on the muscle there, and just work back and forth, digging in. You find some sensitive spots, you're going to probably find some good tightness. The inner thighs can get very, very, very tight here, so spend some good quality time here. Take some nice deep breaths. You find a really sensitive spot, stop on that spot, take a few inhale, exhales, and then of course you can just roll back and forth on it. Just really dig in and understand that you're going to kind of have to move and pivot your body a little bit, but once you find some good spots, once you work this on a regular basis, you'll see some tremendous differences in the way you move and feel. All right, so we're going to foam roll the front of the thigh, the quadricep muscles. What Janella's going to do is she's going to go ahead and lay on top of the ball, and you can start at the knee or the hip, it doesn't matter which direction you start in, but the idea is you're going to roll up and down the full length of that thigh. Now, a couple ways you can do this. For some people, they're real super sensitive. When they do this, it kind of hurts really bad. So breathe through it, go up and down, hold those sensitive spots, just like we do with all foam rolling. But you'll notice that Janelle right now is doing it with her opposite leg on the floor, and that's going to make it much easier or less aggressive. If you need more from this, you can take that opposite leg, put it on top of the leg you're working, and now you're basically fully elevated, except for what's touching the roller and then your arms, and that's going to put more weight, more pressure into the roller as you go up and down. So now we're going to roll the side of the thigh. Want to get technical, we're kind of going up and down along where the IT band is. We're really kind of rolling the vastus lateralis muscle, is the side of your thigh, to be non-technical. And what we're going to do is essentially from the knee to the hip, roll the length of the thigh. You'll notice she's got the opposite foot on the ground. What that's doing is that's taking a lot of the pressure off of that thigh, because this could be a real sensitive one for folks. But if you need more pressure, you just stack your legs and you get after it. All the way from the knee, all the way up into the hip. Take your time. You might feel some bumps in the road, and when you hit those bumps, kind of speed bumps, go back and forth over them, breathe, and just get after it. Next up, we're going to hit the glute. In this example, Janelle's using the foam roller. This could also be done a little bit more aggressively with a softball or a lacrosse ball. And we're kind of getting the glute. We get up into the piriformis up high there. Now, you'll notice that Janelle's doing a little bit more advanced technique. I'd recommend starting with the foot on the ground and just finding the spot. And it can be very sensitive, so you might feel a big conjunct bump kind of a thing. So work through that. If you need want to combine like a good stretch along with that rolling, you need a little more aggression, then you're going to go ahead and cross that leg over the opposite knee and really start digging in. So just work around the entire glute, piriformis, outer glute, the whole butt cheek itself. And again, if you want a little bit more of an aggressive, you need something a little bit more than a foam roller, this is a great way to use a softball or a lacrosse ball. Now we're going to go ahead and foam roll the hamstrings, and we can combine this with the calves. Essentially what we're doing is, if we just work on the calves first, we're just going the length up and down of the calf, so you got to get that roller in place. And you do kind of have to lift your body a little bit to go up and down. What oftentimes with the calves, you're going to find some good knots. This again can be done with a softball. So you're just going to kind of roll side to side. Janelle's using the opposite leg right now to help add a little bit of pressure, and just find those knots. You'll find those in your calves. Oftentimes you don't need to kind of roll back and forth, but you just find that spot. Then from there you can just slide right up into the hamstring and start at the hip or the knee. It doesn't matter, because you're going to do the whole length, and you're just going to run up and down from the glute right to the back of the knee, trying to keep it as smooth as possible as you go. And again, just like every other kind of a roll, you're going to stop and dig into those real sensitive spots. Make sure you're breathing. You can rotate your leg. Remember, there's a lot to your legs, so rotate it from side to side and just find those sensitive areas. Work your breathing. Roll, stop, roll, and just loosen everything up the backside of the leg. Foam rolling the spine, working up and down the back. This is generally folks' favorites. They get some good crack-a-lacking going on here. But essentially what you're going to do is you're just going to roll literally up and down the full length of your spine, enjoying it. Put some weight into it. You do have to make sure that if you're wearing a hood or you got a ponytail, make sure you don't get sucked under. But you're going to roll all the way down to the lower back, and then all the way back up the spine, just below the neck. Again, watch your ponytail if you have one, or if you're wearing a hood. And you can, even with this one, you can roll all the way up from the top of the spine all the way down to the bottom, and even up into the glutes. So just shift your weight, find the spots. You may get some good cracks. They feel good. If you find an area, again, that's tender, sit on that spot, roll back and forth. Make sure with this one, though, you're also really paying attention to breathing. This is one that people tend to hold their breath on. You want to stop. You can stretch over the roller, leaning far back. Take some nice big breaths. And, of course, you can do that the whole length of the spine as well. Really, just find some good spots and enjoy this one.